Okay. I'm going to go ahead and start talking, even though there are some people I think that are still going to come in, but welcome. Kevin, we used to do this a lot more often, and I do miss it.
It's funny. I was just thinking the same thing, that it's been a minute since I've been on one of these webinars, and I feel like you, Angie, Tracy, and I, for the longest time, this was my most social contact.
I know, it truly was a lifeline. And these folks, these names I'm seeing on the attendees list here have been with us for over a year. And I feel like one day we should just host a happy hour or something and all meet in person.
That is a great idea.
So anyway, we are so grateful that you guys keep tuning in to hear us prattle on about whatever topic we decide. Kevin has agreed to be my co-pilot today. As always, he's going to ask thoughtful questions, and of course, your questions can be submitted using the Q&A feature on your screen. And so just a quick note, as you guys know, we record these webinars and we will post them on our website at dominionpayroll.com by the end of the day on the COVID-19 resource page. Submit those questions via Q&A, not the chat, and you can submit those at any time. Sometimes we read them in the moment, sometimes we don't. Oh, look, we've got some people who want to come to happy hour. Excellent. Jerry Ann, I forget how far away you are, but that would be great.
I'm seriously writing this idea down. I think that doing sort of a client appreciation webinar, I don't know, happy hour would be a great thing to do.
Yeah, these are our long haulers here.
That's right.
Maybe it's too soon for that, but anyway, they've been with us for a long time. Or you can submit, if you don't feel like airing your question here in this forum, you can submit questions to questions@dominionpayroll.com. All right, so as we all are aware, in May, things changed. The CDC came out and said, hey, guess what? If you're vaccinated, you can take off that mask and you don't have to wear it. It's up to you, it's optional. If you're unvaccinated, you still need to comply. So I admit that I have not done a state-by-state scan in probably a week or so of different state policies, but for the most part, this is where we are now. In Virginia, for example, this is the language here. So what they're saying is that you should follow the CDC guidance. Vaccinated, no mask. Unvaccinated, mask. Of course, if you're vaccinated and still want to wear a mask, that's fine too. This applies to the workplace, and employers, you guys must require employees to comply with the face covering guidelines in your state or locality. Face shields are not a substitute for a mask, but specified types of face shields may be worn by someone with a medical condition preventing the person from wearing a mask. And employers in Virginia, at least, must provide face coverings to employees and require their use. So if you have some unvaccinated folks who stroll in without a face covering and they can't get one, then you have to provide them. So that's the language in Virginia.
So Lesley,
Yeah.
just to be perfectly clear, if I'm an employer, I've got a restaurant with 15 people, my policy at this point should be, if you are vaccinated, masks are optional, and if you are not, you're required to wear a mask, and I will provide one. Is that right?
Yes, that's the minimum standard at this point.
Yeah. Okay.
You could still say, you know what, we're all going to continue to wear masks. But the minimum standard is
what I described.
Yeah, exactly. And we'll go in more detail about what you all have, what you're allowed as an employer to ask, and how you'll handle that sort of vaccination count, as it were, among your team. All right. So in late May 28th, I think, I got very excited because OSHA updated its FAQs. As you guys know, I've refreshed these same 3 agency websites every morning, and OSHA finally updated the same day the EEOC updated their facts. It was a big day for me. So Kevin's going to put these links in the chat because I know you can't actually click on these. We're going to go through some highlights reel of what the updated guidance from OSHA and the EEOC is. As you know, the CDC the guidance isn't it's not the law of the land, it's guidance. So what happens when the CDC updates its recommendations, and these other government agencies have to sort of scramble to update their rules and regs and policies. So that's what we're going to look at today. Okay, so a couple of the questions that I snagged from the OSHA page that apply to both you and your employees are as follows. Are adverse reactions to the COVID-19 vaccine recordable on the OSHA record keeping log? As you guys know, OSHA requires you to record injuries, workplace related injuries in a log. It's called, their standard is called the 29 CFR 1904. What they're saying here is that they've called the DOL and they've talked and they have decided that they're not going to require any side effects from vaccines to be recorded in the log, at least for now through May 2022, and then they will reevaluate later. So, you know, we might have booster shots or annual shots for this vaccine going forward. And so looks like they're going to evaluate as we go. So that's good news. You don't have to record any vaccinated related injuries or reactions, excuse me, in a log.
So even if I, as an employer, are saying 100% everybody here has to have a vaccine if you're going to come back into the workplace, I don't have to record anything if there is, you know, a sick day or anything like that.
You don't. I mean, you can.
Mm-hmm.
You can, and if you want to record it sort of on your own and document it, sort of wearing my HR hat, I would document it in that person's confidential medical file, just in case for some reason they come back and say, well, I got this vaccine because of your policy and I had this adverse reaction and I want you to pay for my medical bills or something like that.
Gotcha.
But you don't have to submit anything to OSHA about it.
Gotcha. Thanks.
Okay, so sort of switching the dynamic here, this is obviously from the employee side. What can I do if I believe my employer is not protecting me from exposure to COVID-19 on the job? And again, I put in the full answer here. I know it's a lot of text, but I wanted you guys to have it. So as you guys know, you have to comply. You have to provide a workplace free of known health and safety standards, and employees have the right to file a complaint if they feel like that you are not doing that. So if an employee thinks they are being exposed to COVID or that you're not taking appropriate steps to protect them from exposure to the virus at work, OSHA is encouraging employees to speak up. And you are also prevented from not retaliating or discriminating against anybody who speaks up because they take that very seriously. So the final sentence down here, the final two sentences, if you believe you have contracted COVID-19 on the job, OSHA does have some steps on the website that they recommend taking, including notifying the supervisor. So I wanted to include that because that, depending on your respective workplaces, you need to keep that in mind as you sort of craft your policies around masks and vaccinations. Okay, related to this, can my employer force me to work if I have concerns about COVID-19, including a coworker having tested positive, personal medical concerns, or a high-risk family member living at my home? This has sort of been their answer the entire pandemic. Generally, you may require employees to come to work during the pandemic, unless there's some sort of emergency order that otherwise would require them to not come in. But again, they're saying, if you're going to have them come in and they have concerns, you need to make sure that you're making every effort to keep people safe and healthy. And then I list here the under section 11C of the OSHA Act, a worker who refuses to work would be protected from retaliation if these things are true, if they believe they face death or serious injury. The worker tried where possible to get his or her employer to correct the condition, was unable to obtain a correction, and there's no other way to do the job safely. The situation is so urgent that the worker does not have time to eliminate the hazard through regulatory channels such as calling OSHA. So again, that may or may not apply in your situation, in your workplace, in your industry, but those are the standards. And those have always been in place. They just sort of reiterated them and adapted them to the COVID FAQs.
I think it's worth just acknowledging that, as employers out there with the, this whole last 15 months, it feels like the sand has been shifting under our feet and going from sort of 6 feet to 3 feet of distance and mask, no mask. I just think it's worth acknowledging that this is, tough. Nothing really to add to your comment here around OSHA, but just, hopefully these ongoing webinars help clarify some of these things and make sure everybody is right with the law and sort of right with, making sure their employees are being taken care of.
Yeah, I mean, it's a lot to wade through, and I do hope that we are sort of making it clear. Sometimes I'm not often certain of that, but I do like to hear from you guys also, as you know, what is working for you, what's not, what you've already put in place. I know it's been about a month since the CDC updated the mask and vaccination guidance. So we're always open to hearing what, in addition to your questions, what is it, how are things playing out in the real world? So definitely share if you have something that's working well for you. Can I, as the employee, file an OSHA complaint? Yes, if you believe that your health and safety are in danger, you or your representative have the right to file a confidential safety and health complaint with OSHA. So I don't mean that to sound scary, but I do want to make sure that you guys know what OSHA has out there in terms of this current phase of the pandemic that we're in. All right, now, what OSHA lacks in their FAQs are sort of short and sweet and to the point. The EEOC is the opposite. And this page has literally been open on my computer for a year. And I got very excited when they updated their guidance. They also have a much longer URL, but Kevin has put it in the chat. Thank you, Kevin.
Sure thing. I think
All
it's
right.
also worth acknowledging what nerds we've become about updated guidance.
Oh my gosh.
and how this qualifies as thrilling.
Yeah, I know. It really does. Whoops, I'm sorry. Sorry, guys. All right, I am going the wrong direction. Hold on. Hold, please. One day I'll get this figured out. All right, so the EEOC, which we've talked about a lot on these webinars, that's the agency that governs ADA, Title VII, and anything having to do with discrimination, what you can and can't ask in terms of confidential medical information. They're the ones that since December have said, you have every right as the employer, to require employees to be vaccinated. Now, whether or not you go that route in terms of a mandatory policy, we'll talk about that in a minute. But what they say here is federal EEO laws do not prevent an employer from requiring all employees physically entering the workplace to be vaccinated, subject to the reasonable accommodation provisions of Title VII and the ADA and other considerations discussed below. These principles apply if an employee gets the vaccine in the community or from the employer, and we'll dive into that in just a second. Now, please keep in mind that because some individuals or demographic groups may face greater barriers to receiving a vaccination, some employees may be more likely to be negatively impacted by a vaccination requirement. It would also be unlawful to apply a vaccination requirement to employees in a way that treats them differently based on any sort of protected class that we have listed here. So keep that in mind. But this is the guidance from the EEOC. So there's been a lot of, if an employee comes at you and says, this is unlawful for you to have a mandatory vaccine policy, this is where you direct them, unless they have a medical reason or a bona fide religious belief. And there are a couple of forms on our website. If an employee wants to request an exemption from your vaccine policy, you can use those forms to document those requests. They don't go anywhere. They just go to their file, and you give the employee a copy, and then you evaluate each one on a case-by-case basis. Okay, so is information about an employee's COVID-19 vaccination confidential medical information under the ADA? Yes, the ADA requires an employer to maintain the confidentiality of employee medical information, such as documentation or other confirmation of COVID-19 vaccination. This requirement applies regardless of where the employee gets the vaccination. So if they get it on their own at CVS, or if you sponsor an in-house vaccination clinic. Although the laws themselves do not prevent employers from requiring employees to bring in documentation or other confirmation of vaccination, this information, like all medical information, must be kept confidential and stored separately from the employee's personnel files. You can share anonymous information such as we are 80% vaccinated, but otherwise keep the personal information to only those who need to know. And that could be a manager or direct supervisor if you have tasked your managers with helping to enforce and document your vaccination policy. And we'll talk more about that in a second too. So
Lesley, I'm sorry.
yeah, no, go ahead.
I was just going to sort of ask, like, practically, how does some of this work? Let's say you are having a vaccination event at your workplace and encouraging people, or even saying, hey, everybody gets a $25 Amazon gift card if you go get vaccinated. You know, does the ADA cover sort of the anonymity or confidentiality of people standing in line for that sort of thing? Like, how far do employers need to go?
See, now you're asking me to be practical, not theoretical, and this is where I'm just kidding. That's a great question. They don't specifically address that unless I missed something on the page. That's a great question. I think in that case, if somebody is standing in line for a vaccine at a work-sponsored clinic, I think that's sort of their own. They've given permission. They've sort of given permission for people to know that they're getting vaccinated. Does that make sense?
It does, yeah.
You know, I wouldn't take pictures and post without people's permission, like on your Instagram or anything like that. And if somebody wants to remain anonymous, maybe you can arrange for them to get a vaccination at a different time that's not so public, or they can get it on their own, and you can give them some paid time off to get the vaccine on their own. So that's how I would handle that.
Yeah.
Under the ADA, may an employer offer an incentive to employees to voluntarily provide information or documentation or other confirmation that they've received a vaccination on their own from a pharmacy, public health department, or other healthcare provider in the community. And yes, I know incentives have been a big topic this year. And so they're clarifying it a little bit more here. Requesting documentation or other confirmation showing that an employee received a COVID-19 vaccination in the community as opposed to at your work site is not a disability-related inquiry covered by the ADA. Therefore, an employer may offer an incentive to employees to voluntarily provide documentation of a vaccination received in the community. So if you've gotten vaccinated, you know, you get a little card, and that would be something that you could ask incentivize your employees to turn over to you. And once they look, and then what I would do is take a picture of it and upload it to their file and then delete that photo. As noted elsewhere, the employer is required to keep vaccination information confidential pursuant to the ADA. So you can incentivize, but you can't send out an email saying, Kevin Wilson, yeah, congratulations on being vaccinated. So that process needs to be confidential. Does that make sense?
I don't know about you. It does. And I'll say, you know, I'll voluntarily disclose that I am fully vaccinated. When I started hearing about some of these state lotteries and $1,000 bonuses that some companies have been in the news for, it's like, man, if I had only held out a little longer, maybe I could have capitalized on this.
I know. I mean, I'll take $75. I think that's what McDonald's maybe is doing, is saying, hey, if you show us your vaccination card, we'll give you $75. So yeah. Still waiting on that. Okay, so this is the same question, but when employees receive a vaccination administered by you. So this is, again, if you're in the healthcare industry and you're administering your own staff or administering the vaccine to your other staff, or you're sponsoring an on-site event? The answer is yes, if any incentive, which includes both rewards and penalties, is not so substantial as to be coercive. Because vaccinations require employees to answer pre-vaccination disability-related screening questions, a very large incentive could make some employees feel pressured to disclose protected medical information. However, this incentive limitation does not apply if an employer offers an incentive to employees to voluntarily provide documentation that they received the vaccine on their own from a third-party provider. So there's a difference there, and that's why a lot of employers have chosen not to hold on-site vaccination clinics, or small employers. Large employers are more apt to do it, but smaller employers are just kind of, it can get messy if it's not done right. So a lot of folks have just said, you know what, we're just going to give people paid time off to go get it and incentivize them for letting us know about it. Okay, so that was not, I didn't put up all of the EEOC latest guidance on these slides today. I encourage you all to check out and bookmark the links that Kevin has put in the chat, because it's the EEOC page in particular is pretty long. And but if you skip to section K, that's the vaccination section. So you scroll down a little bit. So these are slides from 2 weeks ago, and I just thought that they were worth repeating. So as I see it, and again, there could be a fifth option here that I'm not thinking about, and certainly share with me what you guys are what's working for you guys out there. But the way I see it, there are 4 options for you. You can go full on and make the vaccination a requirement for your employees. You can actively enforce vaccination among your employees. You can incentivize a vaccination, or you can rely on the honor system and just say, you know what, if you're vaccinated and you know it, don't have to wear a mask. If you're not vaccinated, you need to wear a mask. And we will not discriminate or treat you any differently. So unpacking those a little bit, if you go with option 1 and require a vaccination, that means that vaccinations are a condition of employment. You'll be asking for proof, and you're going to document that proof. You can, like I said, take a picture of that card, upload it to their file or put it in their file, make a copy and put it in their physical file, and then make sure you delete. If you have an electronic version, make sure you delete that. Do understand that if you go this route, that any vaccine-related illness or injury may be subject to workers' compensation claims. So keep that in mind. We did a seminar for the employees of a client last week who is requiring the vaccine, and a lot of people had a lot of questions. So I should add a bullet here. If you go this route, you need to really have your ducks in a row and be prepared for questions about the efficacy of the vaccine. One person even asked about if life insurance covers vaccine-related deaths. So they had a lot of great questions, and fortunately they have a chief medical officer who was able to answer them. But if you don't have one on staff and you want to go that route, I would strongly advise partnering up with somebody who can answer some of those questions if you go this route. But you are allowed to go this route if you want to. You just need to plan for anybody who has a medical or religious objection to the vaccine and how you're going to handle that. And again, we do have some sample forms on our website for that. And then you need to hammer out the process by which those folks give you their proof. What's the best way for folks to get that proof to you? Who do they go to? How are you going to keep that confidential? How are you going to document that proof? And how are you going to make sure that you delete any electronic files that aren't properly stored? So that's option 1. Option 2 is what I'm calling active enforcement, and which is not my original term. I snagged it from another webinar, in full disclosure. This is where you would require proof of full vaccination for those wanting to unmask. So you could go I have heard reports of employers saying, great, if you're unmasked, then we want you to produce that card. and/or we're going to test you every morning before you walk into this office. And then you would document, just as you would with option one, you would document the proof as it comes in, and you would need to, again, hammer out that process, communicate that process to your employees, assure them that you're complying with all these federal laws, and be prepared to answer questions. The third option is what I call incentivized enforcement. And that's, like we talked about earlier, you can incentivize sharing proof of full vaccination for those wanting to unmask with whatever makes sense for you: cash, a day off, a gift card, etc. Still, I would document that proof, keep it in their files. And like we said before, like the EEOC said, keep the incentive reasonable. I know that there have been some, like Kevin said, there's some states and maybe some companies that are offering much larger prizes, but keep it reasonable. That way people who are like, wow, well, maybe I could use $10,000, but I still feel a little uncomfortable, but $10,000 could really help me out. It just sort of is a weird kind of squirmy place for them to be in. So you can be creative. The EEOC does not specifically state what the actual anything that you can't offer. You just need to make sure that you offer it to everybody and document. And then the fourth one is what I call the honor system. That's totally putting faith in your employees that they are self-selecting putting themselves in the correct category of vaccinated without a mask or unvaccinated with a mask. And remember, this is, if you go this route, you can message to your employees and say, listen, right now, we're not going to go with the active enforcement or incentivized enforcement approach. We're going to go with the honor system approach, but please, we are relying on you and trusting you to work with us and meet us halfway on this. We have a responsibility to you and all of your teammates to protect you from known hazards, of which COVID-19 is. As of now, if we all can, if we're all kosher with this, then we will not go we won't ratchet up our proof requirement or documentation. So this approach is nice because you don't have to do anything except maybe send out a message like I just stated, and then but you might have some people who have concerns or know for a fact that, or think they know for a fact that somebody is not vaccinated and is still not wearing a mask. And so you're going to have to figure out how you're going to deal with those types of concerns and what action you'll take. What's sort of the threshold for you all to say, you know what, the honor system's not working. Maybe we need to incentivize or act more actively formalize this policy, the enforcement of this policy. So keep all that in mind. This is definitely the lesser administrative burden, but it also means that you really need to trust your coworkers. And if somebody gets wind that you're allowing an unvaccinated person to walk around without a mask and they file that OSHA complaint, that's something that you're going to have to think about how you would deal with.
So just to be totally clear on this, the employer still needs to have that, unvaccinated wear a mask policy in place, but they can, as far as unmasking, go to the honor system.
Yeah, I would, my recommendation is to definitely send out something, no matter which approach you take. Send out something to your employees if you haven't already, because if you just rely on them hearing the headlines about the CDC and maybe here and there about some other vaccination related things or mask policies, I think you need to provide guidance and clarity so that you control the narrative and you give people you provide them with the process for coming to you with any concerns or complaints, even if you go the honor system route. Because if I know this sounds weird because I know cases are going way down, but if for some reason somebody gets, like I said, gets information about an unvaccinated, unmasked employee and even worse, if somebody gets sick, that's on you. So OSHA says very clearly that this is still your responsibility no matter what approach you take. And I don't mean to sound scary, but I just want to make sure you guys have all the information. Okay. So this slide, I should have pulled this out because last time we did a poll and it was fun, and I didn't do it this time and I should have, but last time we did a poll and it looked like, I think if I recall correctly, the active enforcement approach and the honor system were the two most selected ones on in that poll, and that was 2 weeks ago. So I wonder if you guys if anything has changed for you all out there in the world since we spoke 2 weeks ago. All right, so if you just some quick reminders, if you do ask for proof, only ask for the bare minimum. You can ask for proof, just the card is fine, doctor's note, that's it. No other, where'd you get it? How's the experience? Just cut all that out. If they volunteer that information, that's fine. What you cannot ask, and I didn't write this on here, is if they haven't been vaccinated, you cannot ask them why. Unless you're going that requiring the vaccination route, like option number 1, you can, if they volunteer to you that they have a medical condition or a religious belief that prevents them from getting the vaccine, in that if you're requiring vaccinations, then they will need to submit an official request, and then you would evaluate that individually as they come in. So that's sort of the distinction there. Like if you have someone who's unvaccinated and you're using the honor system, you can't ask them why, but you can ask them if. And then you want to make sure you treat everyone equally, do not discriminate in either direction, and make sure your managers know not to do that either. And then enforce your policy. If you put it out there, and I recommend that you do, give your managers or give your team the support to enforce it. It's not, we're not trying to politicize, we're not trying to make people feel in one camp or the other, but this is where we are right now in this pandemic. It's a strange time. It's better than it was a year ago, but we still have some things, some considerations. And so put your policy out there and then give your people the tools and the resources and the support to enforce it, and make sure they know that they just, that everybody needs to be treated equally. And I believe that is all I have. I'm going to take a sip of water.
Yeah, absolutely. I would say while, everybody out there, if you do have any questions, if you're mulling those over, feel free to go ahead and get those into the Q&A. While we wait on that, I will give a little tease for a project that I've been working on. I'm excited about.
Oh.
As many folks in our audience know, I've been hosting the Beacon for the last probably 6 to 8 months. Just sort of been a business-focused webinar, not necessarily in the HR space, but just sort of how folks are operating their business. It's been a lot of sort of looking at how businesses in different industries have been navigating the challenges. Well, we are excited to be doing a bit of a pivot and converting that into a podcast format that is going to start coming out at the end of June. We're aiming for June 29th for that to be out in the Apple Store and wherever you download your podcast, Stitcher, all that good stuff. It's going to be a real similar format to what you've grown to know and love, I hope. But it's going to be a little shorter. We're looking at 25 to 30 minutes and one-on-one interviews with business leaders, thought leaders. And the focus is really going to be a bit forward-looking as we sort of look to the excitement that I think is all sort of palpable for everyone. That this pandemic is coming to a close here in America, it feels like. And, barring anything unforeseen, it looks like the third and fourth quarter of the year are going to be, pretty productive from an economic standpoint. A lot of people are thinking that we may see some interesting changes in the labor market, and we may see a rash of new entrepreneurs. And so we're going to be diving into those topics and more, but I just sort of wanted to tease that, and we'll have more info coming out through our newsletter, social media, and all that. But that's my plug for this Wednesday morning.
Kevin, you're going to be a podcast star. I love it. Can I be a guest?
Absolutely.
Yes.
100%.
I mean, if anything, I believe there's a clear winner during this pandemic, and that's the podcast world. Oh my gosh. I never even listened to one before this, or I listened to them very rarely. And now I listen to them all the time. So, well, that's great. So you said end of June?
End of June. We're looking to having 2 a month come out, and we're looking at June 29th as dropping our first episode. I'm a little hesitant because it's a new project, and who knows what delays will sort of sneak in there. So if you don't see it on the 29th, look for it on the 30th is what I really have to say.
Hold your horses, one more day. Do you know, can you drop a name or two of who's going to be a guest yet, or is that still being worked out?
A lot of that is still being worked out, but I will say I've been speaking with some folks who have volunteered with SCORE, a local sort of small business advice and mentor group. And our first couple episodes are really going to look at the ins and outs of starting your own business and sort of what goes into taking an idea to actually forming your LLC and marketing it and taking a product to market. And that's sort of in anticipation of all the folks that may be starting businesses. I've heard anecdotally a lot of people who have pulled some money out of their retirement, and they've taken this year of sort of introspection and distance to say, you know what, I'm going to be my own boss. I'm taking this idea out there. Or maybe have taken their side hustle and it's their main thing. And so that's where we're going to start. And to tease a couple subjects, we're going to be looking at cybersecurity in small businesses. I'm developing an interesting look at sort of fast fashion and the changing nature of fashion in the workplace. So I mean, it's going to be a great variety of topics out there. And transportation, of course, is going to be a big one. As we sort of look at public transportation and some of the pressures from the pandemic, and then there's also like the Uber and the Lyft and the scooters, and the ever-present promise that self-driving trucks and cars are just around the corner. So a lot of really interesting things that all will have an impact on frankly how we live our lives and how we run our businesses. So I hope folks are as excited about it as I am to host it.
Well, count me in. I have a bunch of topic ideas for you that I will send your way, but
Awesome.
Those all sound really, it's just a product of our time right now. These sort of considerations that we never would have thought. I mean, companies here in Richmond, I know at least one that they bought this old post office and they spent tons of money fixing it up and outfitting it to their needs. And for years it was their hub, and now they're selling it because everyone's
is that Mobilux?
Yeah.
Oh wow, I didn't know that they were getting rid of that location. They're the one though. Yeah.
So wow. It's interesting. And I also, your comment about fast fashion, my dry cleaner went out of business because we've all been wearing yoga pants for 15 months. And lately I've been going into the office and like dusting off actual real clothes and like high heels and stuff. And it's been great, but I realized that like, there's that industry has also been altered. Now I feel like I have too many clothes. I just kind of want to give them away because I don't really wear them as often.
Lesley, I will share my favorite stat that I've read recently in the world of fashion. The CEO of Levi's was on one of the business programs earlier this week and said that a full 25% of their customers are not wearing the same size jeans they were a year ago.
I saw that.
And they're not smaller.
I know, I saw that. And also someone told me that low-rise jeans are coming back, which is a trend that I vehemently am opposed to. So hopefully that won't happen. But yeah, I agree. I think that's just really it's just very interesting to see some of these stats come out after all this time, and see where we go. So I'm excited about this podcast. And does it have a name yet? Is it still going to be the Beacon?
We're going to keep it the Beacon.
Okay.
I think that, I mean, the symbolically shedding light on the world of business and helping folks navigate is still the mission of the program, just slightly different format.
Well, the logo, I mean, the logo alone is
right.
I mean, I got a clipboard for my, you get this like really cool lighthouse. So anyway, I'm never going to let that rest.
Yeah. You know, I feel after this year, maybe I should get it tattooed on my shoulder or something.
You should do it. You know what? I bet there's some interesting tattoo stats out there too. Pandemic tattoo stats, people getting more or less, or the pandemic related tattoos.
You get fully vaxxed on my knuckles.
Yeah. There you go. You want proof? Here it is. All right. Well, thank you guys. No, this is a quiet group today. No questions. So hopefully we were able to provide some information. You can always send questions to the email address on your screen, questions@dominionpayroll.com. We'll be back in 2 weeks with another topic that will to be announced. And then definitely tune in, look out for the podcast that Kevin's talking about. It's going to be a lot of fun and informative and a new thing for us. So we'd love it if you join us on that journey as well. Have a great afternoon. Kevin, any final thoughts?
No, Lesley, thank you for inviting me on. As always, it's a pleasure to work with you on this.
Excellent. Well, thank you. And we will see you guys soon.
Cheers, y'all.
Bye.